My name is Bryan Murphy and I'm a consultant dermatologist at Cathedral Dermatology in Belfast and Kingsbridge Private Hospital in Belfast. What I love about dermatology is the variety within the specialty. Not only are there medical problems that I see, which include rashes such as acne, rosacea, psoriasis and eczema, but there's a surgical component to my role whereby I treat patients with skin lesions, both benign, cysts, moles that catch or rub, and then skin cancer removal for things like basal cell carcinoma or melanoma. Keeps the job exciting every day, coming in, having something different coming through the door each time, and not knowing sometimes what's coming through and what challenges you might have to think about and deal with next. Well, dermatology is a busy outpatient-based specialty, so there's always lots of administration and results to be chasing and following up on. So my day usually starts well before 8 a.m., whereby I check through my emails to respond to any queries from my secretary, and indeed get back to any questions or problems put forward by patients. I would then spend a period of time signing off letters or results that I have in my inbox. And then clinic usually starts about 8:30 or 9 o'clock and would go on until around lunchtime. And I'll see a variety of rashes and lesion problems that come to the clinic and review patients, for example, on the likes of isotretinoin or Accutane for acne, or to discuss results and break potentially even bad news to patients who've had a skin cancer diagnosed. Depending on the day of the week, then I may have a procedure list in the afternoon whereby I do local anaesthetic procedures to remove lumps and bumps or moles or skin cancers. And on other days, I may have another outpatient clinic. Other things that I would see at my clinic would be patch testing, reading, following a series of 5 days where patients have had patches on their back to ascertain an allergen for a contact allergy. And then after clinic in the evening, it's usually a time then to catch up on the letters for that day, making sure the admin's completed, and then finalising any tasks or messages put forward to me again from my secretary. I also do a bit of online teledermatology and would spend an hour in the evenings doing advice and guidance for patients who've sent photo queries through to the portal, and then responding to any queries again from patients virtually who I have advised or treated. So it's a busy day all round, but something that I do find fulfilling and enjoy. I think I have two quotes or sayings that I would give patients as they leave my clinic. First and foremost, particularly in the sunnier weather and coming into the summer at the moment, is not to forget the sunscreen, or don't forget the sunscreen. And for any patients, and particularly that it is now May, that we class this as Skin Cancer Awareness Month, I would say to patients, if you're in doubt, get your skin checked out. Make sure you get a doctor or a dermatologist to check any changing or atypical lesions or marks on your skin to make sure that it isn't something that needs to be cut out or potentially could be a skin cancer.